Yes.
Perfect. All right. Hi, everybody. My name is Natasha Bhatia, and I'm joined here with John Hermanson. I am a PGY4 here at Emory. I'm the administrative chief resident, and John is academic chief. So I'm so excited that we can get to share a little bit more about our program with you guys, and we'll try to save some time for questions at the end, but you guys can always contact us by email or social media or whatever afterwards. All right, so just a quick overview. We're definitely going to go over the rotation schedule and rotation sites that our residents spend most of their time at. We'll go through some academic and didactic experiences, where our residents go after they graduate, and then what we feel like makes our program unique, as well as just life in Atlanta. So this is just a brief overview of our rotations. Main thing, so for PGY2, we have a pretty diverse experience. So we have 2 months of a mixed outpatient rotation. At that time, you get exposure to cardiac rehab, spend some time in the sports medicine clinic, prosthetics and orthotics clinic, and then you also get a chance to do some consults at a SNF, which is pretty unique. In addition to the mixed outpatient rotation, you spend 4 months total at Shepherd Center, 2 months on spinal cord injury unit and 2 on brain injury, 2 months at Emory Rehab on the stroke service, and then 4 months total split into 2 different blocks doing medically complex acute rehab. And I'll be going through some of these rotation sites a little bit more. In our PGY3 year, you get 2 months of pediatric rehab at CHOA. We also spend a lot of time at the Atlanta VA doing general outpatient MSK, as well as EMGs and peripheral joint injections. We spend time at Grady Hospital, which is our level 1 trauma center, as well as doing EMGs there. And then you also have a chance to go back to Emory Rehab Hospital as kind of a more senior resident on the stroke floor. And then PGY4, it's pretty much all outpatient. We spend 2 months on the sports medicine clinic, as well as 2 different rotations through our spine and pain center. Some more time at the VA, where we work with neuroradiologists and the rheumatology clinic, and then of course elective. So Shepherd Center is our specialized standalone neuro rehab hospital. They have dedicated spinal cord injury and brain injury floors. Some unique things about Shepherd: it does have a fully fledged ICU that's staffed by a critical care pulmonologist. So that's a pretty unique experience. You get a chance to take care of patients who are ventilator dependent, some pretty high acuity patients that are able to be taken care of in the rehab hospital. It's also just amazing facilities and amazing staff and physicians at Shepherd. Home call, or call here, is home call. It's split among the 3 residents that are at Shepherd at a time. Yeah, like I said, home call. So Grady Hospital is our level 1 trauma center. Grady is kind of famous in Atlanta and Georgia. They have a burn center as well as comprehensive stroke center. You can see in the photo they have the mobile stroke unit, so they're actually going out to people's homes, you know, when there's a 911 call for a possible stroke, and getting people CT scans right there, really just improving the care that stroke patients get, which is cool from the rehab perspective because you really see some amazing recoveries. And then we also get a lot of experience with traumatic brain injury and spinal cord injury, and then polytrauma patients here too. And I've included some of the physicians that we work with, so Dr. Hinrichs and Dr. Kaiser here. Emory Sports Medicine, this is, I think, one of a lot of residents' favorite rotations. It's located in the brand new Emory Atlanta Hawks facility. So this is like the training facility that's in that very nice fancy building. I think one of the great things about the sports department here is you get tons of experience using ultrasound, both for diagnostics as well as ultrasound guided procedures. You get to work with Dr. Mountner here. He's really one of the leaders in the field of sports medicine and orthobiologics. So that's pretty exciting. Emory Rehab Hospital is where you spend quite a bit of time as a PGY2. There's 4 residents there at a time. So you really build a lot of camaraderie and get to know each other on that rotation. Like I mentioned, there's a stroke service and medically complex service. We do have the support of an internal medicine physician who we consult on patients. So that's helpful, especially for the high acuity patients, to have an internist available. We see a lot of transplant patients as well as LVADs, and then of course a huge volume of stroke patients as well. And when you're on this rotation, you are on in-house call. The benefit of that is that you get a post-call day afterwards. CHOA is our children's hospital. We do inpatient and 1 month of inpatient and 1 month of outpatient here. This rotation is great because you get a lot of experience with procedures, Botox injections, phenol, and then baclofen pump management as well. All right, and then I think John is going to jump in here.
Hey, Natasha, can you hear me?
Yep.
Hey, everyone. Thanks for having us. This is John Hermanson. Like Natasha mentioned, I'm the academic chief here. I was going to go through some of the didactics, lectures, kind of how we approach our learning curriculum at Emory. Big picture, we have a 12-month repeat cycle, which I think is helpful. You get to see every topic, maybe not the exact same lecture, but the same topic 3 times before we go on to take boards. We have didactics Tuesday and Thursday mornings for 2 hours and 3 hours respectively. So it's a decent chunk of time, but it doesn't take your whole day. So we report to our sites afterwards and still get to see some experience on those same days. We have 2 different journal clubs. One of them is our Rehab and Review. Some of you may be familiar with. It's ran by our department chair, Dr. Burke. It's a periodical, and we help summarize pertinent articles that have come out in the preceding month and send it out. And there's a fair amount of programs to subscribe. It's a way to stay current, and it's a good opportunity for us to be both a contributing editor and a collaboration editor as a resident. The second journal club is kind of a spine, MSK, pain journal club, and it's ran by Dr. Monfred, who's our residency director. And we have Paul Weiss. He's from the Department of Biostats and Bioinformatics. Great critical thinker and always challenging us to kind of look into, is this a good study? Why not? Instead of just kind of glossing over some of the lighter duty aspects of some of the research coming out. So great opportunity to discuss topics in depth and go a little bit deeper to understand why we're recommending what we recommend. This year especially, we've slowly been migrating to an online platform, I guess as is the times, but with COVID, we've fully transitioned this year. And a lot of this was led by Natasha and I, so there are a lot of opportunities as a chief to make changes and implement new things in the program. So we've moved to Canvas, where we have our each module, each rotation, as Natasha mentioned, and we have a competency guides, some learning activities, our post-rotation assessments. We record almost all of our Zoom lectures, and they're all available in a resident repository for review. We also have a pretty expansive board review material section, and so you can see everything in one site. Emory hosts an annual P&O symposium, with the caveat that this year it did not happen. It would have been the 5th year. It's gotten bigger every year, and something that we feel pretty strongly about. Especially it's a particular interest of myself. So it should return next year, where we host for both therapists, physicians, nurses, anybody who's interested in the topic. We also do specialty lectures throughout the year, including billing and coding, which I did not appreciate my first year, but turns out it's critically important. Financial education for the residents outside of residency. We have a good group of acupuncture, integrative lifestyle medicine doctors here at Emory. So we kind of broaden our horizons to see what's out there. There's some new clinics in acupuncture that are actually opening up later this year at Emory. And what's nice is we can really tailor this experience to ourselves. So as I get requests for residents for certain types of lectures, I can reach out to any of the attendings here, and they're all very open to participating and teaching us what they know. Excuse me. A lot of hands-on workshops. Again, this year, a little unique, but we are heavy on ultrasound. We're heavy on EMG. We are heavy on spine and Botox. As of right now, even with COVID for the last few months, I have all my numbers and everything except for EMG, and I still plan on taking my 200 mark with EMGs pretty easily. So you have plenty of exposure, and really as much as you'd like. We do an annual cadaver lab where we get a full cadaver, stays in the school of medicine anatomy lab, and we're able to dissect, we're able to do ultrasound, practice injections, and kind of check to see, are we getting where we think we're getting into. So I think a very unique opportunity there, and well supported by our residency program. We have a gait lab in the basement of our main hospital. I think Natasha has a video down there of one of our residents. So it's a split treadmill. So it's really cool. They do a lot of work on post-stroke and Parkinson's, and even a little bit of MS on how to improve gait. There's some excellent seating and wheelchair clinics, both at Emory and Shepherd, kind of a world-class wheelchair seating for the Southeast. All right, next one. Some fun things at Emory. We do Moonlight as a PGY4. It's in-house, which is particularly nice because we sit in Thursday nights at our inpatient rehab hospital, take care of any late admissions, put out fires, but then we also get Friday off. We get paid a decent amount for what we're doing, and you get a 3-day weekend. So it's been really wonderful this year. We have money to go to conferences every year. We get an additional 5 education days. Pretty much if you're going and you're presenting, you should be able to get the days off, with a few exceptions, but they're very lenient, very supportive of research here. We have a $900 book and education allowance over the 3 years, kind of averaged. So, you may spend more your first year, a little bit more your last year, but basically you have the coffer to dip into as you need it. When we're at Emory on call, we get dinner and breakfast, which again is nice, especially kick off a 3-day weekend with breakfast on the house. Again, caveat, things are limited this year, as I'm sure it is across the country. So ultimately, what are we doing here? We're trying to learn so we can go on to get our fellowship, get a job in our career that we want to do. And I think where Emory really excels is, as far as I'm aware, every resident's graduated and gone on to do what they explicitly wanted to do. We do have a lot of pain fellows that leave here. Our last graduating class, one went to UCLA, 2 stayed here at Emory, as a pretty respected program. A couple went to private practice, 1 academic with electrodiagnostics. So leaving here, felt very confident going straight into an academic program and practicing and actually being a leader in that program. The last few years, a lot of pain, some sports, a couple orthobiologics, which is another strength here if you're interested in that. Several faculty that will give you any exposure that you're interested in. And even our current class, we haven't matched yet, but very diverse. There's 5 of us going into 4 different fellowships. And I think I foresee all of us matching to where we want to go, which I think is ultimately the point of what we're here for.
All right, so I'm just going to highlight a couple of things that make our program pretty unique. So for people who are interested in global health opportunities, through the Emory GME, there's a Global Health Residency Scholars Program. I'm actually part of this program this year. It consists of a year-long didactic and small group discussion curriculum, and then kind of culminates in a month-long clinical elective in Ethiopia. We also have a group that has traveled to the Dominican Republic. It's an interdisciplinary group. this past year, Gio here in the photo, he was a PGY2 at that time. He went with this group of physical therapists and PT students, basically for a rehab-focused medical mission trip there. So it's nice because we're affiliated with Emory, who, it's a huge undergraduate campus, huge medical school, business school, public health, and then of course the CDC in Atlanta, just down the street. There's a lot of resources if you're interested in taking advantage of these kinds of things. We have lots of opportunities for sideline coverage, and then like pre-participation physicals. The past couple of years, our residents have volunteered at the Peachtree Road Race, and found that really enjoyable. We have a women in physiatry group here in Atlanta. This is a picture of one of the social get-togethers. It's for women physiatrists who are either faculty in the program or who practice locally, but it's a great way to kind of network, get some support, as well as kind of cultivate some mentor relationships. We are lucky in that we have a lot of social events throughout the year. This photo is from an annual welcome party at one of the faculty's houses. We also have an annual cookout at our department chair's house every year. And then we also have a resident wellness retreat. For the past couple of years, we've done it at Lake Lanier. So spend a weekend up there and just kind of get to know each other outside of work. We have a annual Emory Rehab Hospital Christmas party. That's in a venue with a bowling alley. And then the Shepherd Center also hosts a holiday party at the Georgia Aquarium, which is pretty fun. As far as living in Atlanta, there's so many benefits to being here. It's a really temperate climate, so you can really enjoy being outdoors all year long. There's tons of green space in Atlanta. This is a photo of the Beltline, which is basically a multi-use walking, running, biking trail that connects the neighborhoods of Atlanta. You can walk or ride your bike to restaurants, bars, that kind of thing. This is a photo of Piedmont Park, which is kind of the largest green space in the city. Tons of festivals and concerts happen there throughout the year. We're just a short drive from the North Georgia mountains. You can rent a cabin there for the weekend. Tons of great hiking trails. Atlanta is a really diverse city as far as culture, food, history, and music go. So it's a wonderful place to live. Relatively low cost of living for the size of the city, and just lots of opportunities to enjoy yourself here. So finally, these are just kind of the things that we feel like are huge benefits to this program, or some of our main strengths. Broad experience really prepares you for any fellowship and job. You're able to get paired up with a faculty mentor based on your job interest, or based on your academic interests, and then go from there. Tons of procedure opportunities, really specialized and unique clinical experiences here. And then, of course, the amazing faculty, staff, and residents at our program. So I'm going to stop sharing. Let me see some. Okay, we got some questions here. Okay, can you construct your own electives? So yes, the electives are really very flexible. It's totally up to you. You can do basically in whatever inpatient or outpatient clinic you want. There's a caveat that 20%, less than 20% or less has to be outside the Emory system, but that's usually not very limiting. Any plans for the global health program to travel to other countries? So they have a special relationship with a hospital specifically in Ethiopia. It's kind of a sister hospital to Emory. So that's kind of a sustainable relationship that they've cultivated over many years. So that's kind of their set partner site. But I agree with you. There's, especially now, lots of need in other places.
And unfortunately, we are out of time. Thank you so much, Emory, for that excellent presentation. And we will go ahead and move on to the next residency program.
Sounds good. Thanks for having us. And please reach out. We're able to answer all questions through emails and external resources.
Wonderful.
Thanks.